Hello.
Okay, hi. I was worried why
Hi.
couldn't I see you?
Oh, how are you?
I'm good. How are you?
I'm also fine.
Good. So this is
So am I
another.
audible?
Yes, yes, very well.
Am I audible? Okay.
I hope I am too.
Yeah, actually I had to change the earphone.
Ah,
आवाज नहीं जा
that's
रही
right.
थी वहां से वो पहले वाले earphone से.
Ah, all right. Never
Yeah,
mind.
so let's start.
Yes. So it is another session of HomPed series, which means
Yes,
homeopathy along with pediatrics. How
pediatric.
it homeopathy is useful in pediatrics and how effective it is.
Yes.
Yeah. Sure. Hi, hi, Dr.
So
Nilesh. Hi, everyone.
hello.
Okay, so shall we start?
Yes. So today's topic we are saying is epilepsy and its homeopathic treatment. Epilepsy
That's
in
right.
children actually.
That's
Not
right.
only epilepsy in general, but epilepsy in children.
That's
So
right.
I think you are gonna start the starting part.
Yes, definitely. So
Yes.
we will be discussing epilepsy, and usually a lot of times there are different terms used for epilepsy, like convulsions
Yes.
or seizures, epilepsy
Yes.
itself. So
Yes.
there's
Even common
a lot of
one is fits.
confusion.
Fits. Fits.
Sorry,
Fits. FITS. Fits.
fits. Yes, that's right.
Yes.
Even yeah, in layman language, they usually call it fits. So, like coming in a medical terminology, when people say it is a seizure, so seizure
Yes.
means basically when there's a lot of firing of the neuronal activity keeps on getting fired at a time
Okay.
continuously. Okay, so that is called a seizure, which is only one episode. Okay,
Okay.
when this firing of the neurons occurs only at a single episode, only for a single episode, it is called as seizure.
Seizure.
So today, if
Okay.
I have suppose myoclonic or tonic kind of seizure, so firing of neurons, so it will be called as seizure because it has happened only
Seizure.
once. Okay.
Once. Yes.
Now, when will we call it as epilepsy? Is when I have experienced such seizures n number of times.
Okay.
Okay, so if I've experienced the seizure this today, and after a week or a couple of weeks later, if I experience the seizure again, then it will be termed as epilepsy.
Yes.
Okay,
Okay.
okay.
So
So
it means basically epilepsy is having seizures for more than two times.
that's right.
Okay.
Okay. Now coming to the convulsions part. Okay, so
Hmm.
convulsions uh, is when there is muscular activity involved in the seizure.
Okay.
Okay. We will be coming to the types of seizures later, but there may be seizures where there is no muscular activity involved. Like the patient may just faint or roll eyes or just lie. He may just faint. Okay,
Okay. Yes.
even that is a kind of a seizure.
Yes.
So now, when there is involvement of the muscular part, when the patient is moving his arms, moving his legs, moving his neck to and fro or sideways, okay, so that may be called as convulsion.
Okay. So,
Right?
mm,
So this is the difference between epilepsy, convulsion, and seizures.
so in convulsion, the muscle involvement is compulsory.
Compulsory, yes. Only and only then you can call it as convulsion.
Okay.
Yes. And seizure is the one only single episode of
Yes.
the
I have
neuronal
remembered
firing.
it like S for seizure and S for single episode.
Great, yeah, that is a great mnemonic.
Yes.
Alright. So this was the basic difference between seizure, convulsions, and
Conversion.
epilepsy.
Epilepsy. Yes.
Okay. So now what happens exactly in this epileptic episode or seizure
Hmm.
episode? What happens is there are basically we aren't sure what exactly happens. There definitely we know that there's a lot of neuronal firing that is going on inside the cortex, and but there have been theories that have been placed. So first is the hereditary. Okay,
Okay.
now if a child who has parents that have had epilepsy in their lifetime, whether
Yes.
it may,
Hello.
yes, Chaitanya.
Yes, we are back.
Yeah, I guess there was some
There was
glitch. I
some
don't know in the network or
टेक्निकल
what.
ग्लिच.
I think,
जिन जिन
yeah, we
लोगों
are
ने
so sorry for
फिजिक्स
that.
वाला जिन जिन लोगों ने फिजिक्स वाला देखा है उनको भी मालूम है कि ये लोग कैसे टेक्नोलॉजिकल ग्लिच होता रहता
Yeah, I'm sure. So we are so sorry for the viewers.
है. Yes.
Yeah. So shall we resume the discussion?
Yes. And we were on, I think,
We were discussing the pathophysiology of
pathophysiology.
epilepsy. Yes.
Yes.
So pathophysiology, there are actually, as I told, the first aspect is the hereditary. So if
Yes.
the parents, the mother or the father of the child has experienced seizures or convulsions or epilepsy, there's a probability of the child getting the same disease. Okay, and yeah, so it may be passed to the upcoming for offsprings as well. Okay.
Yes.
Then second aspect of pathophysiology is the biochemical theory.
Biochemical theory. Okay.
Yes. So as I told you, there's no specific pathophysiology that has been noticed, but these are the theories that people have placed. So out of one, which is biochemical theory, where when in the sodium potassium levels of the electrolytes reduce. Okay.
Okay.
In the blood, when the sodium potassium reduces, it causes the difference in the or the changes in the resting membrane potential of the neuron.
Yes.
Okay, so when there is a change in the resting membrane potential, it causes the cell to depolarize.
Yeah.
Okay, so when there is a change in the polarity of the cell, it will start the neuronal firing. That means it will get excited. The
Okay.
neuronal cell will get excited,
Excited. And then
and that
seizure
will
will happen.
result, yes,
Yeah.
and that will result into a seizure. So this is
Okay.
the biochemical theory.
Biochemical
So
theory. Yes.
this happens because when the sodium potassium levels are decreased.
Okay.
All right. Okay.
Yes.
So next is neuropathological.
Neuropathology.
Yeah. So neuropathology is basically where there may be a space occupying lesions.
Hmm.
Okay. And suppose like there's a bleeding inside the brain, inside the cranium, or which this is just a basic theory that has been which we'll be discussing again in the causes as well. Okay.
Okay.
So if there's a head trauma, there may be seizures may occur.
Yeah.
Right?
Any
Then
pathology that occurs.
yes. So any pathology if there's occurring in the inside the cranium that will cause the seizure. Okay,
Seizure.
so this was neuropathological.
Yes.
So next is electropathological.
Electropathology.
Yes. So we all know that there are some neurotransmitters that are present along with the neurons, right?
Yes. Yes. Yes.
So these neurotransmitters are either excitatory to the cell or inhibitory to the cell.
Yes.
Hmm? Means there's a chemical in the inside the cell or along with the cell which causes excitation of the cell, or which will try and inhibit the activity. That is, it will try to stop the activity of the cell.
Yes.
Okay, so there are two types of chemicals. Okay, so the excitatory neurotransmitters, which is epinephrine, acetylcholine. Okay, such neurotransmitters, when they are when they are increased,
Increase.
the excitatory neurotransmitters, and along with this, the inhibitory transmitters like serotonin may decrease.
Yeah.
Okay, now what scenario is happening, that the chemicals which are exciting the cell are peaked up, and the
Yeah.
one which are supposed to stop them, they are not present. They are at the most least quantities, which are less.
Yes.
Right now, what is going to happen? This is a big difference that has occurred. Right. So now, because of the increased excitatory neurotransmitters, the cell is going to get excited. It will give
Excited.
away a lot of
Firing.
yes, neuronal firing again, and which will
Hmm.
again result in the this
Seizure.
result into the seizure. Okay.
Seizures. Yes.
Now, why does this happen usually? Because there may be the uh, most possible postulated theories again for this are hypoglycemia, hypocalcemia, and hypomagnesemia.
Okay.
Hmm. So
Calcium
whenever
decrease,
there is
magnesium decrease, and
a
uh,
calcium
potassium
decrease, glucose decrease, and
glucose.
what did I say?
Cal-
Hypocalcemia, hypoglycemia, and hypomagnesemia.
Magnesium. Okay.
Magnesium, when there is reduction in the magnesium in the blood, there may be occurrence of this increase in the excitatory neurotransmitters and decrease in the inhibitory neurotransmitters.
Yes.
Okay. Another thing is again talking about this hypoglycemia. Um, Whenever there is hypoglycemia occurring, it will cause or when there will be hypoxia. Okay,
Hypoxia. Yes.
hypoxia, if it occurs, what happens is when our body usually does aerobic kind of metabolism, right? Now, when there is
Yes.
absence of oxygen, it will switch to anaerobic oxidation,
Yes.
right? So, when there is anaerobic kind of activity going on, it will give away certain chemicals like ketone, correct? If you remember
Yes.
the Krebs cycle,
Yes.
okay, so it
Yes.
will give away ketones, and which will ultimately result in cerebral edema.
Yes.
Okay, so if again now there is cerebral edema occurring, it is again a space occupying lesion,
Vision.
right?
Yes.
It is going to occupy space in the brain, right? Which we, as we said, is one of the cause of seizures. Okay.
Yes.
Now, if this edema or this swelling is not reduced, it will cause seizures.
Seizures. Yes.
All right. So this is
Yes.
another theory that has been given. Okay. So
Yes.
this was the pathophysiology of seizures that we have seen. What exactly
Yes.
happens inside the brain that causes the patient to have fits or seizures, convulsions, epilepsy, whatever you call it, according to its characteristics. Of course, we saw the difference.
Yes.
What
We
is the
saw
difference
the
between the
difference.
three?
Yes.
Okay. Yeah. So next, shall we move on to the causes of epilepsy?
Yes.
Okay. So now, when there may be even neonatal seizures, like when the baby is just born, right?
Newborn. Yes.
Newborn.
Where
Neonate, we call it a neonate. Neonate, yeah. Neonate is when we call the child baby as neonate is from his birth to 28 days of life.
Okay, birth to 28 days is called as neonate. Okay.
Neonate. Okay. So when the epilepsy occurs during this duration or the seizures occurs during this duration, these 28 days, we will call it as neonatal seizures. Hmm?
Yeah.
Now, why does what happens is during the birth, the baby has to pass through a very narrow birth canal. Okay. So
Yes.
during this passage from the birth canal, there are chances of acquiring a lot of head injuries, right? There may
Yes.
be a forceps involved during the delivery.
Yes. Forceps delivery. Yes.
Yes, there may be a possibility where the gynecologist or the obstetrician have to apply forceps. So these forceps also may cause injury to the head.
Yes.
Okay, now this head injury may cause seizures. Okay, so birth injury or birth asphyxia also, there's a condition called as birth asphyxia which causes hypoxia, and as we discussed about in the pathophysiology how hypoxia may cause seizures.
Yes. Yes.
Okay, now coming to an age group more than a neonate, that is an infant or maybe
Okay.
or maybe a toddler or a child. So infant is from 28 days, 28th day of life to the 1 year of life.
Okay. 28 to 1 year is a new is a
Infant
toddler. Hmm?
is an infant. From
Infant.
28th
Infant.
day of life to the 1 year of life is infant. Okay,
Okay.
okay.
So birth to
So
28 is neonate and 28 to 1 year is a infant.
absolutely right. Yeah. So again, coming to the next age group, there's high possibility of children acquiring various uh, acute febrile illnesses. Okay. Now,
Yes.
whenever there's a fever occurring, there is a possibility if the fever is of high grade, that is if it exceeds more than 102 degree Fahrenheit or 103 degree Fahrenheit, maybe 104 also. So this rise in the temperature will also cause the seizures, okay,
Yeah.
for which we call it as febrile convulsions.
Febrile convulsions. Yes.
Yes. Then coming to the next causes, the space occupying lesions. Okay. Now there
Yes.
may be a head trauma which will cause internal bleeding, intracranial bleeding that we call. Okay.
Yes.
Now there may be in some infections that may occur. Okay. So supposedly maybe some pus occupying lesion or a cyst or
Yes.
parasitic infections as well.
Yes.
Okay, so parasitic infections, see, these parasites usually have a lot of tendency to move around anywhere in the body.
Yes.
Okay, so whenever there's some escape of suppose a tapeworm or any kind of worm inside the brain. Okay, so this condition is called as neurocystocercosis.
Yes. Neurocystocercosis.
That's right. So,
Mm.
neurocystocercosis, so this is again another cause of seizures. Okay, there may be some bacterial infection, there may be some parasitic infection, okay, there may be some viral infection, meningitis. Okay, so such infections may cause seizures again. All right,
Yes.
now next cause is uh, some bleeding tendencies. Okay, the
Bleeding.
patient may have some kind of disease which causes bleeding. There may not necessarily the patient may have a injury only, all right, to the head or to the brain. There may be some diseases like hemophilia, right, which may cause internal bleeding as well. So that is another cause of seizures.
Yes.
Okay. So next is the deficiency of pyridoxine, that is vitamin B6.
Deficiency of vitamin B6. Okay.
This is usually seen in newborns.
Hmm.
Okay, so deficiency of vitamin B6 is usually observed in patients or in the newborns that may have seizures. Okay, so deficiency of pyridoxine is one cause of
Yes.
having seizures. All right. So we have discussed about the trauma. We have discussed about the different infections that may be there. Okay,
Space occupying
and
lesion.
sorry,
Space
space
occupying
occupying
lesions.
lesions.
Yes.
Yes, yes, yes. Okay. Uh, yeah. So the another cause. One thing I forgot to mention in the occupying lesions is also the various tumors that may be present in the brain.
Yes. Yes.
Okay. Yes. So the tumors are again as I said, it is a space occupying lesion. It is again going to trigger the neurons and it is going to cause seizures.
Yes.
All right. So these were the causes, okay, for the seizures or the epilepsy. Okay.
Yeah.
So the seizures which occur in the babies or in any patients also they are of different types. Okay. So out of which the first type which I would like to mention is the tonic clonic.
Tonic clinic. Okay.
So this is one of the type of the seizures. Okay, so what happens in tonic clonic is uh, the patient whenever he is experiencing the seizure, it will be for 20 to 30 seconds. Hmm? The
Okay.
duration of the seizure will be for 20 to 30 seconds, where the patient will roll his eyes upwards. Okay,
Roll his head
the patient will
upwards. Okay.
upwards. Okay, and there will be frothing present at the mouth.
Okay.
Patient will be unconscious, okay, and there will be frothing at the mouth. There will be rolling of the eyes. There may be chances of the tongue bite as well.
Okay. Yes.
Okay, there's a possibility that the patient may bite his own tongue. All right. So there may be clonic type of movements of the body.
Hmm.
All right. So
Yes.
this is the tonic clonic type of seizure.
Yes. Yes.
All right. So next
Uh,
is this is the tonic clonic
let
type.
me interrupt.
Mm-hmm.
Now to tell these the audience that what is tonic and what is clonic. Okay.
Mm-hmm.
So tonic means in which the muscle is in tone.
Right.
Okay. Or the muscle is stiff. That
Right.
okay. When how we know that the muscle is in tone,
Mm-hmm.
मतलब जो बॉडी बिल्डर्स लोग रहते हैं वो दिखाते हैं ऐसा कि ये ना
Yes.
मसल ऐसा टोन में है मेरा,
Right.
so so they make it stiff and show, so that stiffness is tonic. And in clonic there is jerking of the muscles. Okay,
Right.
the muscles jerk. Okay,
Right.
they give a jerk, a sudden movement of the muscles, so that is clonic.
Yes. Absolutely.
Yes. So
So
let's
it
continue.
is a tonic. Yes. So it is a tonic and clonic type of seizure. Okay.
Yes.
So next coming to the myoclonic.
Myoclonic. Yes.
Myoclone. Yes. So again, myoclonic will be also for a short duration. Okay, for again 20 to 30 seconds we can assume, and where there will be a lot of muscular activity involved during this type of seizure. Okay, the
Yes.
patient may flex and extend his arm continuously, or flex and extend his neck continuously, or legs.
Yes.
Okay, but along with as you told, the clonic part as well, jerking of the muscles also.
Muscles.
So it
Yes.
is myoclonic.
Clonic.
Yes. Okay.
Yes.
Then next is atonic.
Atonic.
Uh, Atonic. Atonic means there is no tonicity to the muscles, no tone present in the muscles. The patient may be unconscious or maybe just lying flaccidly. Okay,
Yes.
so there will be no tone to the muscles. The muscles will be flaccid in such type of seizure.
Yes.
Okay, so a tonic kind of seizure, we cannot call it a convulsion,
Okay. Yes, because
right?
there is no contraction of the muscles. Yes.
Exactly. There are no muscles involved in this type of seizure.
Seizure.
So here we can see the difference between convulsions and
And
seizures.
seizure. Yes.
So the type of seizure will define whether to call that seizure a convulsion or not,
Yes.
right? Okay. So we talked about the atonic type of convulsion seizure. Next is the spasm.
Spasm. Yes.
Spasm. Okay. Now in the spasm type of seizure, the patient's certain group of muscles will experience spasm. Okay, where the muscles will contract, relax continuously. Okay,
Yes.
okay. So there will be spasmodic uh, episodes of the episodes seen in the muscles. Okay,
Yes.
so that is the spasms. Okay. So we talked about tonic-clonic, myoclonic, atonic, spasm, and absence again. Okay, absence is one type of seizure where there will be no activity involved, no muscular activity or no movement of the body involved, no rolling of the eyes, no movement of the body, no jerking. Okay, so
Yes.
such a type of seizure also cannot be called as convulsion,
Yes.
right? So these were the types of convulsions seen. Okay. Now another two
Yes.
types or the broad classification basically of the epilepsy is also is the focal and one is generalized epilepsy.
Yes. Focal and
Okay.
generally. Okay.
Focal, focal and generalized. So now in generalized epilepsy, basically the whole body is involved.
Yes.
Okay, and in focal epilepsy, usually one part of the brain or one part of the um, cortex is involved, where there is only a neuronal activity or the neuronal firing is going at that particular focus. Okay, or that particular part of the brain. Okay, which will again result to the activity or the seizure of the particular part of the body.
Yeah.
Right? So this is called as focal, and the other type of epilepsy is the generalized.
Generally.
Okay.
Yes.
Okay. So now we have discussed the difference of epilepsy, convulsions, and seizures. We have discussed the pathophysiology of seizures. We have discussed the broad this classification
Types.
of
Yes.
seizure. We have discussed the causes also. Now,
Yes.
being a parent, what a person is supposed to do when his or her child is experiencing seizures.
Uh,
Okay.
seizure. Yes.
So now we have to understand that seizure is an emergency.
Okay.
Okay, it is an emergency, but in an emergency, the first rule is do not panic.
Yes.
Okay, the parents have to be calm. Okay, and usually what happens is that the child may faint. Sometimes the child may just have a gazing look somewhere. Okay, there may be just a
Yes.
gazing look, or there may
Uh,
be jerking movements. So the parents have to stay calm. They do not have to panic. Definitely, epilepsy is an emergency. Okay, so whenever there is an epilepsy occurring, okay, the child is supposed to be placed in left lateral position.
Okay.
Okay. Hmm? And avoid what the parent has to do is make the child lie on the ground. Okay. I'm sorry.
Yes,
Just give me a minute.
you can drink.
Yeah. Thank you. So, the parent has to make the child lie on the ground, okay, and try and shift all kinds of furniture or whatever is close to the patient that may cause an extra injury to the patient. All right. Now, what
Yes.
usually happens whenever the patient is in an seizure, a seizure is going on, the muscular movements are uh, very, what do you call that? They're very stiff or very hard, or they are very difficult to resist to us,
Yes.
to the third person, or to the another person. You cannot stop them. They are very vigorously happening. Okay, so
Yes.
you have to avoid to stop the movement. You do not have to stop the movement. You know, usually
Okay.
people go एंड पेशेंट का पैर पकड़ लेते हैं, बहुत ही पैर मार रहा है तो, या फिर ना हाथ पकड़ के रख देते हैं, ट्राई टू पिन देम डाउन. No, you should not do that, because what happens, these muscles are under the control of the neurons, right?
Yes.
So no matter how hard you try to keep them down or hold them tight, the muscle is going to contract anyways, and this may again result to the fractures.
Yes.
Okay. So secondary injuries may be the patient may possess secondary injuries due to the mistakes of such bystanders or parents or attendants. Okay, so you have
Yes.
to avoid touching the patient.
Okay.
Right, just what the parent has to do is try and keep the patient in the left lateral position. That means the patient is lying down and on his left side. The patient will be kept turned towards the left side.
Yes.
All right. It is also called as Trendelenburg's position. This left lateral position. It is also called as Trendelenburg's position. Okay. And suppose if there is a lot of froth coming from the mouth.
Hmm.
Okay. The parents should always avoid putting something into the mouth, trying to clean it, trying to look inside. Okay. Why they should not put the fingers into the mouth, try to clean the froth, because whenever there is a seizure occurring, the muscles of the
Jaw
jaw
muscle.
are also contracting and relaxing, right? So there
Yes.
is a possibility that there may be tongue bite. Okay. There may be a
Yes.
possibility that the child may even bite the fingers of the parents.
Yes.
Okay. And when there's a bite of the fingers of the parent during a seizure, there may be a probability of injuring the parent's fingers very badly.
Yes.
Okay, so in an emergency, we would definitely want to avoid another injury and another emergency. We do not
Yes.
want extra injuries occurring. Okay, so the parent should always avoid putting fingers or trying to clean the mouth. Okay. And
Yes.
next is uh, first we have removed all the extra things or whatever is present around the patient that may cause again injury, right? Now we have to wait until the seizures finish. Okay, we have
Yes.
to wait. We cannot do anything. कोई बोलेगा चप्पल लेके आओ, चप्पल सुंघाओ. कोई बोलेगा कांदा लेके आओ, कांदा सुंघाओ. No, that is not going to help, and it does not help.
Yes. Yes.
पीपल
Yes.
से कि नहीं, मैंने तो किया था, मैंने उसको चप्पल सुंघाई थी कि तब वो जाके उठा, या फिर ना मैंने प्याज सुंघाया उसको तो तब जाके वो उठा. कि
और
नहीं
ऊपर
भाई,
से
जब तक
वो ज्यादा बढ़ा सकता है क्योंकि the in some cases the smell is a triggering factor,
Yes.
और इससे ना वो convulsions और भी बढ़ सकते हैं.
Yes.
Again you are giving that trigger.
Yeah, again triggering it. Right. So, as I said, there are many people claiming कि नहीं मैं उसको चप्पल सुंघाया तभी वो उठा है. कि बट नहीं भाई, वो 20 से 30 सेकंड का ही एपिसोड था. उसी 20 से 30 सेकंड में जाके तू प्याज लेके आया है. ओके. सो या फिर तू अपनी चप्पल वॉट एवर इट इज यू हैव गॉन, यू हैव रन एंड यू हैव कम. सो इट इज जस्ट क्या बोलतं, एक मराठीत म्हण आहे की कावळा बसायला आणि फांदी
फांदी तुटायला.
तुटायला. येस. सो
Yes.
इट इज दॅट. So you should not apply any kind of onions or any kind of footwear to the like people as they do, they bring it near the nose and they try to smell it. So that is a malpractice. I totally do not recommend it.
Yes, and it's a myth.
Yes, it is absolutely a myth. So you have to allow the seizures or the convulsions to come to rest.
Yes.
Now, the next step will depend on the condition of the patient, whether the patient has had a tongue bite or not, whether the patient has had the froth or not. Okay, if the patient has had any secondary injury or not. Okay, now here what we have to do is we have to secure the A, B, and C of the patient.
Yes.
Okay.
A, B, and C of the patient.
Yes. So A is the airway.
A for
So
airway.
A
Yes.
is for airway. Then B is for breathing,
Breathing.
and C is the circulation.
Circulation. Okay.
Okay. So airway, breathing, and circulation. These three things we have to secure while the patient is in the seizures. So what did we do to secure airway? We kept the patient in the left lateral
Left
position.
position. Yes.
Okay. Now what happens when the patient is lying in a supine position? Okay. In an unconscious state, there's a possibility of tongue fall,
Hmm.
right? So that will, what it will do, it will close the airway.
Airway.
Now, if the airway is closed, there will be no breathing occurring, correct?
Hmm.
So again, the
Yes.
patient will land into hypoxia,
Yes.
which will again trigger the epilepsy,
Yes.
right? So when we kept the patient in a left lateral position, we have secured his airway and breathing as well. Ultimately, the
Yes.
breathing also. Okay. Now talking about the circulation, there may be a possibility that there is an internal bleeding, or there may be a fracture occurring, because these movements are so hard that the patient may bang his hand on the table, or it will depend on whether the environmental things that are present around him. Okay.
Yes.
So that if that has caused any injuries to the patient. Okay, so such bleeding sites or any kind of the where there may be a blood loss, that should be secured. Okay,
Yes.
all right. So in such a way, we should always try and secure is the airway, breathing, and circulation of the patient. Okay.
Yes.
So, when we are in hospital setup, we have a lot of medicines like midazolam, okay, which is usually, if I remember, it is 0.1 milligram per kg of the weight. This
Body
is
weight.
the
Okay.
dose of the midas, okay, used in the pediatrics, okay, or lorazepam is used, again the same dose, 0.1 per kg of the body weight.
Yes.
Alright. If if we are in the hospital setup, we can make use of oropharyngeal airways also. These are the devices. Okay, small devices which help us secure the airway, which do not allow the
Tongue
tongue
tie.
to fall. Hmm?
Okay.
Okay, this is what is done in the hospital setup, but at home or when there's a non-medico person, for the non-medico person, I would advise is let the first put the patient in the left lateral
Yes,
position,
lateral
remove
position.
all kind of things that will cause extra injuries to the patient, and wait for the seizure to rest.
Yes.
Okay, so this is what as a layman or a parent can do whenever his child is in
Seizure.
whenever his child is experiencing seizure.
Yes.
So that is all about the management of the epilepsy that we can
Yes.
do.
Now let's see the homeopathic part, I think.
Yes.
Yeah.
Let
So
me just grab a pencil or pen or something to
yeah,
write
and
down.
I have also the notes ready. So
Yeah, yeah.
let's see. Abhi, and let's switch the language also. Yeah. It will be Hindi and English. So that's known as English.
Yes.
So let's start. Now why
Okay.
होम्योपैथी? होम्योपैथी क्यों देना है ऐसे पेशेंट्स को जिनको है ना कन्वर्जन्स होते हैं जो 20-30 सेकंड के लिए रह रहे हैं, ठीक है?
Hmm.
तो क्यों? क्योंकि ये 20-30 सेकंड के लिए रह रहे हैं लेकिन उसके पूरे लाइफ टाइम है ना उसको वो अफेक्ट कर रहे हैं. Okay, it's affecting that child's health, that child's even the memory, even the academics, and everything of the child is getting affected because of this epileptic episodes. So
Right.
ऐसे में और कोई ज्यादा परमानेंट क्योर नहीं है. होम्योपैथी में परमानेंट क्योर मिल सकता है इसका, इसलिए होम्योपैथी
Hmm.
लेना.
Yes.
ओके. एंड होम्योपैथिक मेडिसिन कैसे है वो एड्रेस करेंगे फिजिकल सिम्टम्स को भी, एंड इवन इट विल एड्रेस द ट्रिगरिंग कॉजेस. मतलब ये चीजों से ट्रिगर होता है ना, होम्योपैथिक मेडिसिन
Hmm.
देने के बाद वो ट्रिगर भी कम होगा, उसको है ना मतलब नॉइस होगा तो है ना उसको इतना अफेक्ट नहीं होगा, इम्यूनिटी विल इंक्रीज. ओके. सो वो ट्रिगरिंग फैक्टर्स पे भी है ना काम करेगी होम्योपैथिक मेडिसिन. एंड होम्योपैथिक मेडिसिन जो है वो साइड इफेक्ट्स नहीं है उसमें. ओके. कोई भी दुष्परिणाम नहीं होगा. फिर इट्स नेचुरल एंड इट इज नॉन एडिक्टिव. ओके.
Yes.
कोई कोई
Most
पेशेंट
importantly.
एडिक्ट हो जाते हैं उसको. ओके. दैट गोली लेनी पड़ती है उनको. सो इट्स
Yeah.
नॉट एडिक्टिव ऑल्सो. तो इसलिए होम्योपैथिक मेडिसिन ऐसे एपिलेप्टिक पेशेंट्स को देनी चाहिए. तो अभी होम्योपैथिक अगर मेडिसिन देना है
Hmm.
तो थोड़ा केस टेकिंग पार्ट थोड़ा होम्योपैथिक टाइप लेना पड़ेगा. ओके. सो होम्योपैथिक केस टेकिंग कैसे लेना है एपिलेप्टिक एपिलेप्सी इन चिल्ड्रन में. ओके. सो फर्स्ट वी हैव टू नो द टाइप ऑफ सीजर. ओके. किस टाइप का सीजर है, फोकल है, पार्शियल है. ओके.
Yes.
टोनिक है, क्लोनिक है, मायोक्लोनिक है. ओके.
Yes.
विच टाइप ऑफ सीजर इट इज. ओके. दैट वी हैव टू नो. उसके हिसाब से मेडिसिन देना है. देन हाउ इज द ऑरा. ओके. ऑरा. नाउ व्हाट इज ऑरा. इट इज अ feeling, it is a subjective feeling of the patient that now
Right.
the epileptic attack will come, he gets aware about that. That is aura. Then consciousness. अभी कुछ एपिलेप्सी में ऐसा रहता है कि है ना कॉन्शियसनेस चला जाता है.
Hmm.
कुछ एपिलेप्सी में ऐसा रहता है कि है ना द पेशेंट इज स्टिल कॉन्शियस.
Hmm.
ओके. ही इज स्टिल कॉन्शियस ड्यूरिंग द सीजर. देन अटैक के बाद वो कैसा रहता है, डज ही गेट स्लीपी और ही इज स्टिल एक्टिव. देन
Hmm.
इवन द बॉडी पोस्चर्स वो कैसा कर रहा है. जैसे
Hmm.
कि मायोक्लोनिक में बताया, हेड हिला रहा है, हाथ ऐसे वगैरह कर रहा है. ओके. व्हाट टाइप ऑफ बॉडी पोस्चर्स ही इज डूइंग, दैट इज इंपॉर्टेंट. इवन द पोजीशन ऑफ द थंब इज इंपॉर्टेंट इन चाइल्ड ड्यूरिंग एपिलेप्सी. ओके.
Hmm.
मतलब चाइल्ड है, चाइल्ड क्या हिस्ट्री देगा. हाँ. तुम जाओगे चाइल्ड को देखोगे एपिलेप्सी में है, व्हाट हिस्ट्री यू आर गेटिंग? नथिंग। तो चाइल्ड को देख के ये ना तुमको पता रहना चाहिए कि ना ये मेडिसिन देना है इसको. सो यू हैव टू सी द थम्स आल्सो, यू हैव टू सी द आईज आल्सो, एंड यू हैव टू चेक द पल्स आल्सो. आईज देखो, थंब देखो, पल्स देखो, कॉन्शियस है नहीं है, वो देखो. देन पेरेंट्स से पूछो क्या ट्रिगरिंग फैक्टर था, कैसे हुआ, क्या हुआ. ओके, दैट. देन व्हाट आर द कॉज, जैसे अलग अलग कॉजेस बताए, कोई स्पेस ऑक्यूपाइंग लीजन तो नहीं है, चेक कराओ. ओके, यू हैव टू चेक दैट आल्सो. ओके. बहुत से लोग बोलते हैं कि होम्योपैथिक वाले ना इन्वेस्टिगेशन नहीं कराते. ऐसा नहीं है, हम भी इन्वेस्टिगेशन कराते हैं, एंड वी हैव टू नो द कॉज behind that. Then, but in homeopathic practice, you have to see what are the individual symptoms of the patient. Okay, what are the general symptoms of the patient? मतलब कि जनरल सिम्टम्स में भी आता है कि ना पेशेंट का माइंड कैसा है, एंड पेशेंट जनरली फिजिकल जनरल्स कैसे है उसके. ओके, एंड वी हैव टू सी व्हाट आर द अकम्पनिंग सिम्टम्स. सीजर तो है, उसके साथ क्या हो रहा है, उसके साथ और भी कुछ तकलीफ हो रही है क्या उसको. तो ये सब चीजें केस टेकिंग में देखना है.
Okay.
Then comes the rubric parts. Okay, now रेपर्टरी में एमडी किया है मैंने, इसलिए ना मैं रूब्रिक्स को थोड़ा अच्छे से बता रहा हूँ.
हम भी वही चाहते
एपिलेप्सी जो
हैं.
है, एपिलेप्सी जो है, हाँ, वो अभी मैं सिंथेसिस रेपर्टरी में मैंने ना एपिलेप्सी डाल के देखा, एक भी रूब्रिक नहीं है. ओके, फिर मैंने ना कन्वर्जन्स डाल के देखा तो मुझे ना रूब्रिक्स मिले उसके. सो यू हैव टू सी दैट एपिलेप्सी के लिए नहीं है लेकिन कन्वर्जन्स में है. ओके, नाउ अभी चिल्ड्रन की बात कर रहे हैं तो सो देयर इज अ रूब्रिक नोन एज, वो जनरल्स में मिलेगा. ओके, ऑल दीज आर इन जनरल्स, not in extremities but in generals. In generals you will get generals, conversion, children in. Generals, conversions, children in. Okay, उसमें मिलेंगे 96 medicines. Okay, उसमें से है ना सबसे prominent है 9 remedies. Okay, those 9 remedies are Artemisia vulgaris, belladonna. Okay, इतना मत लिखो, मैं बाकी इंडिकेशंस बताऊंगा. Artemisia vulgaris, belladonna, cinna, helleborus, opium, pulsatilla, stramonium, veratrum album, and zincum mat. Okay, these are the 9 prominent ones. Okay, अभी ये तो हो गया जनरल कन्वर्जन्स, चिल्ड्रन इन, दिस इज अ मेन रूब्रिक. ओके, अभी उसके नीचे अगर जाके देखे सब रूब्रिक्स, ओके, और द सब हेडिंग्स, वी विल सी conversions in children when the attention is diverted to them. ओके, ऐसे बच्चे जिनके ऊपर अटेंशन आ गया तो उनको वो कन्वर्जन्स में चले जाते हैं. ओके, एंड इसमें आता है एंटीम टार्ट.
ओके,
सिंगल रेमेडी एंटीम टार्ट when the attention is directed to them. So how it is, केंट में उन्होंने दिया है, the patient cannot bear to be looked at, to be touched, to be looked at, and to be talked to. Okay, the child cannot bear to be looked at, देखना भी नहीं, टच भी नहीं करना, और बात करना तो भूल ही गए.
This is very similar to chamomile as well, right?
या chamomile में अलग है थोड़ा. Okay, chamomile में the cry is so much that we can guess that this is a chamomile child. Okay, that
Yes,
irritation
absolutely. But this that you mentioned, that the child cannot bear to be looked at, cannot bear to be touched, is also
yes,
found in chamomile as well.
yes,
Is
it
that
is
I could
also,
correlate?
yes, you can also correlate with Sina also. Sina
Then
may be.
also, yes.
Yes. सो एंटिन
Yes.
टार्क मिल गया, सीना मिल गया, चैमोमिला मिल गया इसके लिए. देन कम्स convulsions in children with diarrhea. Okay, convulsions in children and मैंने जैसे बोला अकम्पनिंग सिम्टम्स भी पता रहने चाहिए, कंकोमिटेंस. उसके साथ क्या हो रहा है? कन्वर्जन तो हो रहे हैं लेकिन उसको डायरिया भी हो रहा है.
Hmm.
ओके, दैट इज नक्स मोस्टेटा. दैट
Hmm.
कम्स इन नक्स मोस्टेटा. ओके, नक्स मोस्टेटा में कैसा रहता है? हिस्टेरिकल फिट्स भी रहते हैं, फेंटिंग रहता है, ड्राउजीनेस, स्लीपीनेस, इवन देयर इज थर्स्टलेसनेस नक्स मोस्टेटा में. Then convulsions in children when you try to hold them. Okay, when you try to hold them, the child goes into convulsions. So that is in Nicolam met, Nicolam metallicum.
Nicolam.
Yes, इसका बहुत ढूंढा, कुछ कन्वर्जेंस के बारे में ना ज्यादा सिम्टम्स नहीं मिले मुझे. एंड दिस इज यही सिम्टम मिला मुझे ज्यादा.
अच्छा.
देन convulsions children in infants. Now as you told newborns, infant, तो infant में में आता है हेलिबोरस एंड इग्नेशिया. हेलिबोरस एंड इग्नेशिया.
Heliporus ka, if I am able to recall, there is movement of the left leg, I guess. Constant movement of the
Yes,
left leg.
of one arm and one leg.
One.
Okay, one arm and one leg.
Hmm.
ऐसा हेलिबोरस में है.
Hmm.
हेलिबोरस में जैसे आपने कॉज बताया था कि है ना, सेरिब्रल इडिमा. सेरिब्रल इडिमा से स्पेस ऑक्युपाइंग लीजन टाइप एंड देन इट गेट्स ट्रिगर. सो सेरिब्रल इडिमा में भी हेलिबोरस दे सकते हैं. ओके, टू दैट चाइल्ड. ओके, हाइड्रोसिफेलस.
I
Hydrocephalus.
forgot to mention that.
Yeah. So H for Helleborus, H for hydrocephalus. Yeah. And Ignatia. Ignatia भी infant में काम आता है. आई विल टेल. उसका है ना, उसका बहुत एक कैरेक्टरिस्टिक है, वो अलग रूब्रिक दिया है उसके लिए स्पेशल, मैं बताऊंगा.
Sure.
तो इन इन इन्फेंट्स हो गया. इन न्यू बॉर्न्स. ओके, इन न्यू बॉर्न्स देयर आर 4 रेमेडीज गिवन. आर्टेमिशिया वल्गेरिस, बेलाडोना, क्यूप्रम मेट एंड नक्स वोमिका. ओके.
Nux vomica.
Yes, nux vomica in newborns. So एक एक ऐसा रूब्रिक है, नर्सिंग while the angered or frightened mother is. जब मदर एंग्री हो जाए या फ्राइटेंड हो जाए एंड उसके बाद वो नर्सिंग करे एंड द चाइल्ड गोज इनटू कन्वर्जन.
This is chamomilla, chamomilla.
चैमोमिला है उसमें, चैमोमिला है उसमें.
And wait, this is uh, that remedy for, oh God,
इट्स
the
bufo,
lode. Okay.
bufo,
No.
chamomilla, nux vomica and
Okay.
opium.
Opium. Okay.
ओके, सो ये है, मतलब कि है ना, मदर जब एंग्री हो जाए या फ्राइटेंड हो जाए और उसके बाद अगर वो है ना चाइल्ड को नर्स करने लगे,
Yes.
देन द चाइल्ड
Yeah.
गोज इनटू कन्वर्जन.
Yes.
यस. देन कम्स, हाँ, अभी एक वीक चाइल्ड है. ओके, द चाइल्ड इज वीक
Hmm.
and he goes out for a play and he plays excessively or he laughs excessively. Okay, ज्यादा खेलता है, ज्यादा ज्यादा ही हंसने लगा, ज्यादा खेलने लगा. ओके, मतलब जितना वो कर सकता है उससे ज्यादा. ओके, when there is excessive playing or laughing, then it is cophia. Then
Okay.
that remedy is cophia.
Yeah. Okay.
Then from the approach of strangers. ओके, चाइल्ड के पास कोई स्ट्रेंजर जाएगा, ही गोज इनटू अ कन्वर्जन. ओके, दैट चाइल्ड गोज इनटू अ कन्वर्जन. सो इट्स लाइसिनम, ओपियम एंड टेरेंटुला. लाइसिनम, ओपियम एंड टेरेंटुला. ओके, टेरेंटुला का यू कैन डिफरेंशिएट, इज इट अ actual conversion or he is just feigning a conversion. Okay.
Yeah, there's a feeling of disease. Yes, the
Yes.
tarantula patient does. Yes.
Tarantula. वो someone is approaching, उसको लग रहा है कि नहीं ये क्या करेगा क्या नहीं, इसके पहले हम ही कर डालते हैं, हाँ कन्वर्जन में चले डालते हैं, हाँ चैमोमिला चाइल्ड,
Yes.
हाँ सॉरी टैरेंटुला चाइल्ड, हाँ मारने को कोई जा
Mm-hmm.
रहा है, हाँ मार होने से पहले है ना ही इज गोइंग इनटू कन्वर्जन्स एंड ड्रॉपिंग एंड फेंटिंग एंड फिर है ना लोग बोलेंगे कि है ना तुमने इसको मारा ही क्यों, उसने मारा ही नहीं रहता है.
Hmm.
So tarantula. Then during the complaints of teeth or dentition, when a
Okay.
child goes into convulsion, is chamomilla, cuprum met and ignitia.
During dentition.
During dentition, during any complaints of teeth in children. Okay, there is chamomilla, cuprum met and ignitia. कोई
Cupromet
कोई
you
लोग
said. And
कैमोमिला भी स्पेल करते हैं.
yes.
Anyways,
Yeah, but I
uh,
believe instead of getting stuck in the correct pronunciation,
pronunciation.
the administration of the medicine is more important.
Yes. And even writing the medicine in prescription is more important.
Yeah. So during dentition or complaints
uh,
of teeth, chamomilla, cupromet, and what did you mention?
ignitia, ignitia, ignitia. ignitia
Hmm.
बहुत इसमें दिख रहा है, इन्फेंट में भी दिख रहा है.
Yes.
देन ठीक है. देन फ्रॉम वर्म्स. ओके, कन्वर्जन्स इन चिल्ड्रन फ्रॉम वर्म्स. ओके, नाउ फ्रॉम वर्म्स जो है,
Hmm.
वी कैन टेक इट दैट वो सिस्टोसार्कोसिस कुछ तो बताया था,
Neurocystosarcosis. Yes.
न्यूरोसिस्टोसार्कोसिस.
Yes.
हाँ, तो उसमें भी है ना वर्म्स कई ये पैरासाइट कई जाके दिमाग में चले जाते हैं,
Yes.
उसके लिए भी है. ओके, या इन जनरल पेशेंट को है ना वर्म्स है एंड बिकॉज ऑफ दैट देयर इज कन्वर्जेंस इन दैट चाइल्ड.
Yes.
सो उसमें सिंगल रेमेडी दिया है सिकुटा विरोजा.
Okay.
ओके, बट आई थिंक देयर शुड बी एन एडिशन ऑफ सिना आल्सो.
Definitely.
देन कम्स a rubric there is given. अभी ये खत्म हो गया. क्या जनरल्स, कन्वर्जेंस, चिल्ड्रन इन एंड उसके सब
Mm-hmm.
रूब्रिक्स. ओके,
Okay.
अभी दूसरा रूब्रिक देखते हैं. उसमें है जनरल्स, कन्वर्जेंस, एपिलेप्टिक, चिल्ड्रन इन. जनरल्स, कन्वर्जेंस, एपिलेप्टिक, चिल्ड्रन इन. उसमें 10 ही ड्रग्स दिए, 10 मेडिसिन दिए. वो है इथुजा,
Okay.
आर्टिमिसिया वल्गेरिस, बेलेडोना, बुफो, कैलकेरिया, कैमोमिला, क्यूप्रम, इग्नेशिया, सिलिशिया and sulfur. Okay, these are the 10 given in that. Now let's see another rubric which is very similar to this rubric. Okay, but it is not the same. That
Okay.
is general convulsions, epileptiform. Okay, not epileptic, epileptiform convulsions, children in. Now what is this epileptiform? I found it. Epileptiform convulsions means any convulsions which are attended by the loss of consciousness. Any convulsions in
Okay.
which there is a
Mm-hmm.
loss of consciousness is epileptiform children in.
Mm-hmm.
उसमें दिया है मर्क एंड टॉक्सिकोप्लाज्मा गोंडाई. ओके, मर्क सॉल
Okay.
एंड टॉक्सिकोप्लाज्मा गोंडाई. नाउ मर्क सॉल का तो है ना मिल जाएगा, सिम्टम्स मिल जाएंगे. लेकिन है ना
Mm-hmm.
टॉक्सिकोप्लाज्मा गोंडाई का मुझे भी है ना कई सिम्टम्स नहीं मिले. ओके, फ्रॉम
Okay.
वेयर टू रीड
Okay.
आई हैव टू सर्च मोर. ओके,
Yes, sure.
देन उसमें वापस एक सब रूब्रिक है, सब रूब्रिक है वो, that is in infants. Okay, epileptic form children in infants is toxicoplasma gondii only.
Okay.
Okay, now another rubric is there. General convulsions, heat during, okay, during heat in children's, in newborns, heat during in children, in newborn children. When there is heat, there is convulsions, and there is only single remedy known as camphora.
Okay, so Dr. Chaitanya, this heat during, shall we consider it as a fever?
We can consider it as the heat stage of fever.
Hmm.
Okay, during the heat stage of it, we cannot consider it as the full fledged fever. Yeah, chill भी है, heat भी है,
Yes,
sweat
yes,
भी है.
yes.
But if it is the heat stage, okay, heat
Hmm.
during, then we can even consider it as the surrounding is heated.
Yeah,
The
exactly.
surrounding of the
That is
child is heated.
what I wanted to ask. Is it the fever? The heat means the fever or the environmental heat?
Yes, because in fever chapter we are not getting this camphora over there.
Hmm.
Okay,
Hmm.
we are getting it in generals. So in general, if we see, then the heat during maybe the surroundings. Okay,
Hmm.
it
Hmm.
may also be that heat during means the heat stage of fever, because
Right.
it, because if we consider fever, fever is also a general
General symptom. Yes.
symptom. Okay, it has symptoms, but which are of the generally of the patient
Hmm.
as a whole.
Yes.
Then heat during can also be considered, okay, in mind level.
Hmm.
Okay,
Hmm.
in mind level, that surrounding is heated means what? एक तो समर वेदर चालू है, या रूम गर्म है, या जो भी है, या उसको गर्म कंबल से ना ढका गया है, वो तो है. बट सराउंडिंग इज हीटेड, दैट माँ पापा झगड़ा कर रहे हैं,
Hmm.
and
Hmm.
there is a heated argument going on,
Hmm. Hmm.
and at that time also the child is getting into, and that also the child is a newborn, and then he
Hmm.
is
Hmm.
going into convulsions.
Hmm.
So at that time also we can think of camphora.
Okay. Sure.
Okay. Then comes general convulsions. हाँ, ignitia का. General convulsions periodical are at the same hour in children. मतलब उसी टाइम पे ना उसको फीवर आता है, 3 बजे तो 3 बजे ही फीवर आता है, सॉरी
Okay.
फीवर नहीं, कन्वर्जन आता है.
Hmm.
Okay, that is the periodicity of ignitia
Okay.
convulsions in child.
Hmm.
Okay, now let's see some indications of some remedies. Okay, उसमें आता है सिकुटा विरोजा, सबसे पहले आता है, सबसे इम्पोर्टेंट रेमेडी है.
Yeah.
और सिकुटा विरोजा में कैसा है, देयर इज वायलेंट डिस्टॉर्शन ऑफ द बॉडी,
Hmm.
वायलेंट डिस्टॉर्शन ऑफ द बॉडी, मतलब कि है ना पूरी बॉडी ऐसे विकृत हो जाती है. ओके, मतलब अलग अलग पोजीशन में वो पेशेंट आ जाता है ड्यूरिंग कन्वल्जन. नाउ सिकुटा में क्यों आता है, क्योंकि है ना देर आर सम एलिमेंट्स फ्रॉम सप्रेस्ड इरप्शंस, ailments from brain tumor, space occupying lesion. Okay,
Hmm.
during dentition, as I told, teething child, by
Okay.
worms and by injury to the head also, जैसे वो causes बताए थे. Then comes type of seizure. So tonic seizure, clonic seizures, cataleptic seizures, catalepsy. Okay,
Hmm.
catalepsy में कैसे रहते हैं, सीजर्स रहते हैं, बट देयर इज अ लॉस ऑफ कंप्लीट लॉस ऑफ द कॉन्शियसनेस, कैटेलेप्सी. देन कम्स द ट्रिगरिंग फैक्टर्स. ट्रिगरिंग फैक्टर्स सिकुटा विरोजा में कैसे रहते हैं, टच की वजह से, नॉइस की वजह से उसको कन्वर्जन आते हैं. टच, नॉइस, कॉन्कशन. नाउ कॉन्कशन इज व्हाट? कॉन्कशन इज अ ट्रांसिएंट अनकॉन्शियसनेस. ओके, थोड़े टाइम के लिए ब्रीफ अनकॉन्शियसनेस हो जाता है या अल्टर्ड कॉन्शियसनेस हो जाता है. कब? जब है ना हेड के ऊपर ब्लो लगता है, दैट इज कॉन्कशन. एंड एंड जारिंग. नाउ जार, ओके, जार मतलब कि है ना जब वो पेशेंट को, चाइल्ड को झटका लग जाता है ऐसे तुरंत, तब वो
Yeah.
कन्वर्जन में चला जाता है. एंड टोबैको स्मोक. Tobacco smoke also they can hear.
Yeah. Jar
Then aura.
best explained can be like whenever we are sitting in a car or whenever we are sitting in a bus. So whenever the driver applies brake, the jerk we get
Jar.
is the jar. That is the
Yes.
jar.
Yes.
Yeah. So
Yes.
people usually get confused between this jar and jhatka, you know. So I just thought of
Yes.
explaining.
Yes. 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 Even Kent has explained it in Belladonna, I think,
Yes.
that when the patient is lying on the bed and someone just passes and वो बेड को है ना थोड़ा सा धक्का लग जाता है.
Mm-hmm.
So what the patient feels is a jolt. Okay, so that jolting is that jarring. Okay,
Jarring.
jar. So let's see. Cicuta का convulsion.
Mm.
Okay, there is violent
Mm.
distortion of the body. इतना याद रखना है. कुछ भी
Yes.
कैसा भी है ना उसका पोस्चर हो सकता है, लेकिन
Mm.
एक पोस्चर है जिसे हम कॉमनली बोलते हैं मेडिकल टर्म्स में ओपिस्थोटोनस.
Yes.
ओपिस्थोटोनस पोजीशन. ओके, ये हम नक्स वोमिगा पॉइजनिंग में भी देखते हैं आई थिंक.
Yes. In tetanus as well, I guess.
इन टिटेनस.
Opposite.
यस.
Yes.
यस, इन टिटेनस. सो इसमें कैसा रहता है, द हेड एंड द हील्स. ओके, हेड एंड द हील्स टच द बेड और द ग्राउंड
Mm-hmm.
and the spine is bending backwards. Okay, so it is an arch like position. So इतना हो गया. Then during dentition this child has grinding of teeth. Okay, मतलब वो दांत मसलता है, दांतों का
Mm.
मसलना. देयर में भी लॉक जॉ
Yes.
also. ओके, जिसे ट्रिसमस भी बोलते हैं, क्लेंच जॉ भी बोलते हैं. एंड सिकुटा विरोजा को अगर है ना जानना है, उसको प्रिस्क्राइब करना है, ये सब तो कॉजेज है, सिम्टम्स है, लेकिन उसको एक अबनॉर्मल एपेटाइट रहता है. ओके, सिकुटा को है ना चौक बड़ा पसंद है, चौक खाते रहते हैं, इनडाइजेस्टिबल थिंग्स खाते रहते हैं.
That's
ओके, इवन दे ईट कोल, चारकोल्स. हाँ, अब ये लोग सोचेंगे कि है ना ये कैसा बच्चा है, ये चारकोल खा रहे हैं. हाँ, लेकिन ऐसा सिम्टम में लिखा है, चाइल्ड ईट्स देम विथ अपेरेंट रिलिश, मतलब स्वाद से खाता है वो, उसको चाहिए और वो स्वाद लेके खाता है. दिस इज कैरेक्टरिस्टिक ऑफ सिकुटा इन दैट कन्वर्जेंस. फिर आता है आर्टिमिशिया वल्गेरिस. ओके, नाउ आर्टिमिशिया वल्गेरिस अभी पेटिट मैल एपिलेप्सी और ग्रैंड मैल एपिलेप्सी जो बताया, ओके, उसमें मैं थोड़े एडिशन करना चाहूंगा कि है ना व्हाट इज इन पेटिट मैल सीजर. ओके, पेटिट मैल और ग्रैंड मैल में ऐसा रहता है कि ग्रैंड मैल सीजर्स आर a serious type of seizures. Okay, then in petit mal there is absence of seizures. Okay, there is absence of seizures और वो seizures दिखते नहीं है. And in grand mal seizures the patient gets unconscious and he falls down. And in petit mal, the patient does not, he gets unconscious, but he does not fall down. Okay,
Okay.
there is an altered consciousness, but he does not fall down.
Mm-hmm.
Now, petit mal सीजर के लिए आर्टिमिशिया वल्गेरिस इम्पोर्टेंट क्यों है? क्योंकि उसमें डायरेक्टली ऐसा सिम्टम दिया है, petit mal seizures, the patient walks in the street, suddenly stops, stares into space. Okay, this staring into space is a symptom given in petit mal uh, seizures also. Okay, the patient is staring. Petit mal then stares into space, often mumbles a few words, becomes normal and remembers nothing. Okay, he is not falling down. Okay, he mumbles a few words and becomes normal, and then he remembers nothing what happened for that brief second. Then ये petit mal जो है, ये बच्चों में क्यों इम्पोर्टेंट है ये petit mal seizures? क्योंकि ऐसा दिन में 20 से ज्यादा टाइम होता है. ओके, मतलब हो सकता है 20 से भी ज्यादा टाइम हो सकता है, कभी 50 भी हो सकता है, कभी ज्यादा भी हो सकता है. और ऐसा है ना, थोड़े थोड़े इंटरवल के लिए, ब्रीफ इंटरवल्स के लिए ऐसे सीजर्स आएंगे, वो थोड़ा अल्टर्ड कॉन्शियसनेस में चला जाएगा, कहीं पे भी है ना ऐसे स्पेस में देखता रहेगा, तो टीचर क्या बोलेगी? टीचर बोलेगी क्या ये पढ़ता नहीं है, ये कुछ भी देखता रहता है, बाहर देखता रहता है.
अटेंटिव है.
ओके, but they don't understand that he is having a petit mal seizure. The child is having a petit mal seizure. वो उसके ग्रेड्स में अफेक्ट करता है. और पेशेंट को कैसा फील होता होगा? हाँ, मीन्स आई एम लिसनिंग टू अ लेक्चर, दैट चाइल्ड इज लिसनिंग टू अ लेक्चर, एबीसीडी सिखा रहे हैं, एबीसीडी टू जेड, बट व्हाट इज हैपनिंग कि वो ए सुन रहा है, बी सुन रहा है, सी डी नहीं सुन रहा है, ई एफ जी सुन रहा है, लेकिन उसके बाद का नहीं सुन रहा है. ओके, बिकॉज ही इज गेटिंग दैट ब्रीफ एपिसोड्स ऑफ सीजर्स. तो ऐसे इसमें है ना आर्टिमिशिया वल्गेरिस बहुत काम में आता है. ओके, directly Pathak has given it like it has a prominent place in convulsions of diseases of childhood and of girls at puberty.
Okay. Artemisia vulgaris.
अभी और एक चीज है, petit mal में there is no aura. Aura is absent. In artemisia also there is no aura. Okay, before the attack the patient may be irritable, excitable. During the attack the epilepsy is without an aura. There may be menstrual disturbances. And after the attack it is important, profuse offensive sweat of garlicky odor, अदरक जैसा odor रहता है उसके sweat का. And even after the attack seminal emissions में occur. So ये क्यों होता है आर्टिमिशिया में? Because of some fright, after some grief, and after a blow on the head. Okay. ठीक है, एक रेमेडी बता देता हूँ, बहुत शायद थोड़ा बोर हो गया होगा, तो है ना एक अच्छी वाली रेमेडी बताता हूँ जो सब लोग जानते हैं, सब लोगों ने ना 5 मार्क के लिए बहुत बार लिखा होगा उसको. ओके, एंड दैट इज इटूजा. ओके, इटूजा. नाउ इटूजा जैसे हम जानते हैं, इटूजा इज द पेशेंट, द चाइल्ड इज ड्यूरिंग डेंटिशन, or there is a summer weather going on, or the child has been given milk and the child cannot bear milk. Okay, ये सब ailments from है उसके. अभी epileptic convulsions कैसे इटूजा के? ओके, 2 मार्क को आते थे हमारे टाइम पे, अभी तो एमसीक्यू आते हैं. then epileptic spasm is like it is with closed, no, with clenched thumb. Now I said thumb का position पता रहना चाहिए. It is clenched thumb. Okay, there is clenched thumb and the eyes are turned downwards. Okay, and you are told that eyes are upwards in during convulsions, but here the eyes are downwards. Yes. Here the thumbs are clenched, eyes
Clarity.
are turned downwards. Then the eyes, then the pupils are fixed and dilated.
Mm.
Okay, torse लेके देखोगे तो pupils are fixed and dilated, and there is foam at the mouth. Okay, as you told, there may be froth at the mouth. Then jaws are locked. Okay, so there is clenching of the teeth, and the pulse will be quick, hard, and um, quick, hard, and small, quick, hard.
Okay.
Okay, or you can say racing pulse, but feeble.
Okay.
Then not feeble, it will be hard. Touch
Yes.
करेंगे, it will be hard. Then after spasms, after spasm इठूजा कैसा हो जाता है? Drowsy.
Drowsy.
Okay,
Weak. Mm.
drowsy, weak, prostrated. That is after spasm in इठूजा. ये हो गया इठूजा का spasm. अभी मैं एक स्पेजम बता रहा हूँ एगेरिकस का. ओके,
Okay.
एगेरिकस में कैसा है कि है ना वो चाइल्ड ही इज बीन पनिश्ड और ही हैज बीन स्कोल्डेड और देयर इज सप्रेस्ड eruptions in that child.
Mm.
Okay, in agaricus child, before the episode he will yawn, ऐसा yawn
Oh.
करेगा. Okay, and then during the episode there is epilepsy, there is convulsions. लेकिन जैसे आपने बताया कि है ना कन्वर्जन्स इतने हार्ड रहते हैं कि है ना किसी ने भी है ना वो कन्वर्जन स्टॉप करने की जरूरत की कोशिश नहीं करनी चाहिए. ओके, अभी इसमें ना मटेरिया मेडिका में ऐसा सिम्टम दिए है इन एपिलेप्सी एंड कन्वर्जन्स इन एगेरिकस द फिजिकल स्ट्रेंथ इज इंक्रीज्ड एंड ही कैन इवन लिफ्ट हेवी लोड्स.
Okay.
ही कैन इवन लिफ्ट हेवी लोड्स, मतलब आप कितना भी है
Those.
ना उसके ऊपर लोड डाल के देखो, ही कैन इवन लिफ्ट दैट. ओके, भारी से भारी है ना लोड वो उठा सकता है.
Mm.
देन एगेरिकस इज फेमस फॉर ट्रेमलिंग, ट्विचिंग, जर्किंग motions,
Mm.
spasms, okay, and especially of the eyelids and of the tongue.
Okay.
Okay, अभी हेलिबोरस में you had said that one arm and one leg is
Yes.
affected. Okay,
Mm.
so in agaricus it is like it is diagonal and the right arm, okay, the right arm
Mm.
and the left leg is
This is
affected
an agaricus.
in agaricus. Yes. और शांत कैसे होने का? वो एगेरिकस शांत कैसे होगा? ड्यूरिंग स्लीप ही. ओके, ही गेट्स,
Okay.
मतलब नींद आ जाए उसे तो अच्छा लगता है.
Mm. Mm.
नाउ एंटिम टार्ट का बताया था, कैन नॉट बियर टू बी लुक्ड एट, टू बी टच्ड. ओके,
Mm.
नाउ इट इज लाइक एंटिम टार्ट में कन्वर्जन्स है, ट्विचिंग है, जर्किंग है, स्पैज्म है. ओके, ये ट्विचिंग, जर्किंग, स्पैज्म में डिफरेंस क्या है वो जरा देख ले.
Yeah, sure.
ट्विचिंग क्या है, जर्किंग क्या है, स्पैज्म क्या है? कहीं तो लिखा था मैंने, लेकिन ऐसे भी बता सकता हूँ. ओके, स्पैज्म तो कैसा है ये? इट इज एन इनवॉलेंटरी कॉन्ट्रेक्शन ऑफ द मसल.
Mm.
ओके, जो वॉलेंटरी मसल्स रहते हैं वो इनवॉलेंटरीली कॉन्ट्रैक्ट करते हैं स्पैज्म में. ओके, सो और कॉमनली कैसा है वो थाइस में, काल्स में, फीट में स्पैज्म आता है. देन जर्किंग, जर्किंग का कैसा है? इट इज अ क्विक मोशन and involuntary motion of the muscle movements.
Of
Okay,
the
एकदम
muscle
quick.
movements.
Yes, quick and involuntary muscle movements. जैसे स्लीप के टाइम पे, अगर कभी किसी ने स्लीप के टाइम पे स्लीप स्टार्स महसूस किए होंगे, मतलब कि है ना अभी नींद लगने वाली है एंड थोड़ा सा है ना ऐसा झटका आता है, ऐसा ऐसा.
Mm-hmm.
सो दैट इज अ
Mm-hmm.
jerking, that is jerking. Then
Yes.
twitching, twitching को है ना, the medical term is also fasciculations.
Yes.
Now in twitching, what is happening? The muscle is getting contracted or tightened involuntarily. Involuntarily, that muscle is getting contracted. Okay, there is small rapid involuntary contractions of the muscles. जैसे कि काल्फ मसल है ना, टाइट हो गया, okay, and it is getting contracted. So that is a type of twitching what is happening. Okay, and trembling भी देख लेते हैं. Trembling is what? It is a shaky movement. Okay, it is a shaky movement. It is not voluntarily, it is involuntary, but it is a shaky movement of one or more parts of the body. Okay, उसे ट्रेमर्स भी बोलते हैं, हाथों को ऐसे ट्रेमर्स आना. इट इज अ शेकी मूवमेंट. क्रैम्प्स क्या रहता है? क्रैम्प में देयर इज अ शार्प पेन. ओके, जैसे कि एब्डोमिनल क्रैम्प है. ओके, सो देयर हैज टू बी पेन इन अ स्पैज्म, इन अ क्रैम्प, नॉट इन अ स्पैज्म. स्पैज्म में पेन नहीं भी हो सकता है, नहीं होता है, लेकिन क्रैम्प में पेन होता है. ओके, so it is a sharp pain that occurs when the muscle suddenly contracts, okay, or tightens up. If the muscle is suddenly contracting and tightening up, but there is no pain, it is a spasm. Okay. और भी थोड़ा देख ले, शिवरिंग क्या रहता है? शिवरिंग भी सुना होगा. शिवरिंग is like there is a muscular contraction also and relaxation also. Contraction and relaxation. Okay, it is a type of body का रिएक्शन जब है ना उसको हीट पैदा करना रहता है बॉडी में. ओके, इट हैपेंस मोस्टली ड्यूरिंग फीवर्स. शिवरिंग. नाउ शिवरिंग से राइमिंग एक वर्ड है क्विवरिंग. QUIVR. क्विवरिंग. ओके, इट इज लाइक it is shaking of the muscle or a shaky movement with trembling also. Okay, there is also a shaking also and trembling also. Yes. चलो, बोट हो गया. हम भटक गए कि क्या?
Yeah, we were at antim tart.
We were at antim tart. So antim tart में वही कि ना उसको है ना हम we cannot bear to be touched, talked or looked at. Okay, and antim tart always wishes to be carried. Okay, carried in an upright position. Okay, upright रहा तो और अच्छा लगता है उसको. He always wants to be carried. Whereas चमो मिला वो है ना कैरी करके भी है ना वो रोता ही रहता है. Okay, चमो मिला. Then comes buforana. Okay, buforana is a remedy जिसमें there is epileptic fits during sleep. Okay, जब भी वो रात में सोने को जाता है, there is a fit. There is a fit happening. Okay, then convulsions are also because of some suppurative conditions. Okay, कोई कंडीशन, कोई suppurative condition है, and the patient is getting into convulsions at that time. But in buforana, what is happening? The aura is felt at the genital area. The aura will be feeling at the genital area. Epileptic seizures occur during night. Pathak sir direct writes like that. Epileptic seizures occur during night, and it is connected with the sexual sphere in buforana.
Okay.
Okay, epileptic seizures at the time of menses in women when the sexual desire is excited.
Okay.
And in young people due to onanism or during coition. And the attack is followed by headache. Okay.
Okay.
इसमें वो सो नहीं रहा है, उसको हेडेक हो रहा है. Is not getting drowsy and sleepy, he is getting a headache. Okay. Now, why these convulsions occur in children while the mother is nursing the child and she was angry or frightened? इसमें
Okay.
भी बुफो है.
Before है.
Okay. And बुफो का कैसा रहता है? The mind remains childish. Only the body is growing, and the mind is childish only. Then एक कॉज बताया था, फिब्राइल कन्वर्जन्स कुछ बताए थे आपने. फिब्राइल कन्वर्जन्स. ओके. फिब्राइल कन्वर्जन्स के लिए दो रेमेडीज है. दो रेमेडीज बताऊंगा. एक है बेलाडोना, दूसरा है नक्स ओमेगा. ओके. बेलाडोना में कैसे रहते हैं? एपिलेप्टिक फिट्स ड्यूरिंग फीवर, but the face will be red, hot. Okay. It is a great children's remedy, is written by Burik. Okay. Directly italic में दिया है. It is a great children's remedy. Then epileptic spasm is followed by nausea and vomiting in belladonna.
Okay.
And the convulsions in belladonna will start from the arm.
Okay.
Arms. belladonna के convulsions arm से शुरू होते हैं. बुफोराना के जेनिटल एरिया से शुरू होते हैं. क्यूप्रामेट के फिंगर से शुरू होते हैं. फिंगर से, टोज से, ऐसे. मतलब कन्वर्जन स्टार्ट कैसे होते हैं वो भी इम्पोर्टेंट है. और अबाउट
where it starts.
Yeah. Then spasm is followed by a prolonged unconsciousness in belladonna, and suddenly violently कभी भी spasm आते हैं, कभी भी convulsions आते हैं, that is belladonna. Suddenness and violence characterizes belladonna.
Yes.
अभी देखते हैं कैलकेरिया कार्ब. ओके. कैलकेरिया कार्ब में ऐसा है, there is an epilepsy and the aura spreads from the solar plexus. Now where is the solar plexus? You know?
No, I'm unaware.
Even I was not aware. Now I know that the solar plexus is actually over here. Okay. At the pit of the stomach.
Okay, near the xiphoid process.
Near the xiphoid process, at the pit of the stomach, there is solar plexus. Okay. It is also known as celiac plexus. Celiac plexus. Okay. So the aura spreads from here. Okay. Running up the arms.
Okay.
Okay. Down or down the epigastrium. Okay. नीचे. Towards the uterus or towards the limbs.
Okay.
But it is like a mouse is running. Okay. It is like a mouse is running up the arm or down the epigastrium or down the to the uterus or
towards
the limbs.
The legs.
Yes. So ये ऐसा रहता है कि ना एक माउस ऐसा रन कर रहा है. दिस इज इन कैलकेरिया कार्ब. अभी कैलकेरिया कार्ब को डर भी है ना माउस से रहता है, माइसिस से. वी कैन रिमेम्बर लाइक दैट. एपिलेप्सी भी है ना, उसको महसूस भी ऐसे ही होता है. सिमिलरली है ना, थोड़ा सल्फर में भी वैसा ही है. हाँ, माउस इज रनिंग डाउन द आर्म्स. ओके. देन हमने कैम्फोरा भी देखा था. कैम्फोरा कुछ देखा था.
Yes, camphora. Heat during in children in newborn.
Yes, during heat. And अभी कैम्फोरा में कैसा रहता है? कैम्फोरा इज फॉर सी एंड इसमें बहुत सारे सिम्टम्स सी से चालू होते हैं. कोल्डनेस है, क्रैम्प्स है, कन्वर्जन्स है. ओके. सो ऐसे बहुत सारे सिम्टम्स सी से चालू होते हैं कैम्फोरा में. विथ मेंटल एंग्विश. ओके. सो एक लाइन में सम अप करना है तो है ना, coldness, cramps, convulsions with mental anguish is camphora. Coldness, cramps, convulsions. Now convulsions are with blue lips, froth at mouth, locked jaw. Okay, these are some of the common symptoms. Then there is tetanic spasm of the teeth. Okay, with retraction of the lips. Okay, lips are getting retracted. followed
Yes.
by stupor, followed by a near unconscious state uh, with coldness. Okay, so वही हो गया cramps, cramps, coldness, convulsions, ये तीन चीजें.
Right.
But the thumb is drawn backwards. Okay, the
Okay.
thumb is drawn backwards. एक
Backwards.
था thumbs clenched है, but the thumb is drawn backwards in camphora.
And in Ethusa, the thumb
It
it
was
is clenched.
clenched.
Right. So
Okay,
this is Ethusa and this is camphor.
camphora. Yeah, all the best. ऐसा. Then comes कैमोमिला या चैमोमिला, क्या है बोलते क्या उसको,
Doesn't matter.
convulsions during dentition.
Hmm.
Okay, there is repeated spasm of the face, arms, legs, etc. And during convulsions, the body will become stiff. Okay, so it is a tonic जैसा. Okay, with ophistotonous position. Okay, the eyes roll about, as you said, ये rolling about है, tonic clonic में
Yeah.
roll about है. Then the face becomes dry and the thumb is turned inwards. एक
Okay.
backwards था, एक inwards है. Okay,
Okay.
chamomilla. Then convulsions of children from nursing after a fit of anger in mother. Okay,
Yeah.
अभी इसमें fit of anger in mother, इसमें भी हम differentiate कर सकते हैं. मदर अगर एंग्री हुई उसके बाद ब्रेस्ट फीडिंग किया उसने, तो चैमोमिला और नक्सवोमिला. ओके, द एंग्री रेमेडीज. एंड अगर फियर फ्राइट की वजह से है तो ओपियम. ओके, she got fear, she got frightened and now she is breastfeeding, so opium. ओके, ओपियम में एक सिम्टम है ना कि है ना क्या, लॉन्ग फियर रिमेन्स या फ्राइट रिमेन्स इन हिज माइंड.
Right.
फिर सीना का मैंने बोला था, वो सिकुटा के साथ है ना इंक्लूड कर सकते हैं वो रेमेडी में. सीना में कैसा है, देयर इज एलिमेंट्स फ्रॉम वर्म्स. ओके,
Worms.
नाउ
Yes.
सीना में कैसा है, इन स्पैजम्स द चाइल्ड विल थ्रो द आर्म्स फ्रॉम साइड टू साइड,
Okay.
ओके. देन कन्वर्जन्स इज विथ कॉन्शियसनेस इन सीना. वर्म कंप्लेंट्स ऑफ चिल्ड्रन विथ कन्वर्जन्स. ओके, अभी शॉर्ट में ले रहा हूँ. ओके, देन कॉफिया में कैसा है, देर इज कन्वर्जन्स आफ्टर एक्सेसिव प्लेइंग और लाफिंग इन वीकली चिल्ड्रन. ओके,
This remedy is
दिस रेमेडी इज कॉफिया. एक्सेसिव प्लेइंग और लाफिंग इन वीकली चिल्ड्रन. ओके, कन्वर्जन्स इन टीथिंग चिल्ड्रन आल्सो कॉफिया. ओके, इन विच द पेशेंट विल ग्राइंड द टीथ, दांत ऐसे पीसने लगेगा with the coldness of the limbs.
Yes.
Then conam का कैसा रहता है, the convulsions are hysterical.
Okay.
Yes,
Hysterical
convulsions
convulsions. Okay.
in conam. But in conam there is contusions, blows की वजह से, ओवर स्ट्रेनिंग की वजह से, ओवर वर्क की वजह से भी है ना उसको convulsions आते हैं. ओके, एक बताया था कुपरामेट का कैसा है कि है ना, the convulsions begin from the fingers. Okay, the aura is in knees also. Okay, knees से भी है ना कुपरामेट का है ना convulsions शुरू होता है.
Knees.
Knees.
Okay.
Okay, it starts in the knees, ऐसा लिखा है.
Okay.
Okay, knees, toes, fingers और and radiate over the whole body. और कौन से टाइप के कन्वर्जन्स, टोनिक क्लोनिक,
Tonic clonic.
यस. Then there is ailments from fright, vexation, and also it is written that metastasis from one organ to the other.
Okay.
Okay, metastasis from one organ to the other. So how can we relate it with the pathology or with the causes? Metastasis from one organ
Metastasis,
to the
so
metastasis we see in
cancers.
cancers.
Yes.
Yes, but yeah, in cancers to the brain, from one organ to the brain. Okay,
Mm-hmm.
so if the metastasis is going on from here to the brain, okay, so we know even the cancer cells are gonna uh, affect the brain. So
Proliferate can cause some space occupying lesion, I believe.
yeah, तो इसमें भी कुप्रमेट याद रखना है.
Okay.
ओके, सो इसमें बहुत सारे सिम्टम्स हैं, उतना कुछ बताने की जरूरत नहीं है. बट इन चाइल्ड, in
Hmm.
cupramet, okay, the convulsions of the children during dentition, child lies on the abdomen and
Hmm.
jerks the buttocks up. Okay,
Okay.
you can remember a song, Hi Garmi. Okay, Hi Garmi song याद रखना है चाइल्ड के लिए.
Yes, and the
In
remedy is
cupramet,
cupromet.
cupramet. Okay, that type of convulsions are there. There is jerking of the buttock up and the
Very
child is lying on the
well
abdomen.
correlated, doctor. Very well correlated.
Of course. वो मुझे तो वैसे ही क्लिक हो गया कि आएगा. Okay, the spasm, there will be spasms with blue face and clenched
Hmm.
thumb. Okay, the thumb is clenched in this cupramet. Clenched thumb, cupramet.
Clenched
It was
thumbs.
it was में भी था,
Yes.
cupram में भी. Okay, हेलिबोरस का I told you. Okay, हेलिबोरस का एक चीज याद रखो, हेलिबोरस, हेलो, ग्लिच.
Just give me a minute.
Okay,
Am I audible, doctor?
yeah, you are audible.
Yeah, but first, can you just speak something for me to check if you are audible to me?
हेलो, 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 हेलो,
Hmm.
हेलो. Am I audible to you?
That's okay. I've just. Oh, yeah.
Am I
You can continue.
audible?
Yes.
Okay. So in Helleborus, we Dr. Pathak has told how to remember this Helleborus state. Okay,
Hmm.
the Helleborus state. It is like hell, hell and black, hell and black. Okay. So what he means to say by black is that everything around the patient looks dark. Okay,
Okay.
look dark means that the patient is in a low states of vitality. There is a very serious disease going on. Okay, it means that the patient is in a condition of hell. He is just, means he may pass away. Okay,
Okay.
that type of serious condition is there in
Okay.
Helleborus. Okay, so there is ailments from checked exanthemata or checked eruptions and blows, or checked eruptions means suppressed eruptions and blows on the head. okay, or even disappointment in love. Okay, children की हम बात कर रहे हैं, disappointment in love. Okay, and even feeble and delicate children. We have to think of this helleborus. Convulsions and twitching of the muscles. There is automatic motion of one arm and one leg. Okay, there is an automatic motion. Then epilepsy is with consciousness here. Okay, epilepsy with consciousness followed by a deep sleep. Convulsions with extreme coldness in sucklings. Okay, in sucklings means in what? In the infants. Okay, convulsions in infants. And what is the characteristic over here is that helleborus child, the convulsions will stop or will arrest when there is a noise. When there is a noise, the convulsions, the paroxysm of the convulsions get arrested. Okay, this is very characteristic over here. Then हायोसाइमस का कैसा रहता है? हायोसाइमस में कन्वर्जेंस के बाद एक बहुत डीप स्लीप रहती है. ओके, एंड देयर इज कन्वल्शंस और स्पेजम्स विदाउट कॉन्शियसनेस, very restless, and in which in Alzheimer's every muscle of the body twitches from the eyes to the toes. Every muscle will twitch.
In Alzheimer's.
Yes, in Alzheimer's. Okay, the child will sob and cry without waking. Okay, he is sleeping, he will cry, he will sob in during his sleep only, but he will not wake up. Okay, and now there is a term known as automatism. Automatism. Okay, automatism में कैसा रहता है? ये कन्वर्जेंस नहीं होता है, ये एपिलेप्सी में ही होता है. कौन सी टाइप ऑफ एपिलेप्सी है वो? It is, wait, let me just recall it. Automatism occurs in partial focal type of seizures. Okay, in complex partial seizures. So उसमें कैसा रहता है? There is a purposeless any movement the patient does. Okay, जैसे कि आई ब्लिंक करना purposelessly. Okay, or he will just rub his hands, or he will walk in a circle only. Okay, this is automatism. वो उसके कंट्रोल में रहता नहीं, वो खुद ही करता है. Okay, or he will make any mouth movements. Okay, or he will pick up the bedclothes, picking of the bedclothes. Okay, or picking of the clothes. So ये picking of the clothes is seen in Alzheimer's. Okay, Alzheimer's का तो ऐसा भी है ना, डॉक्टर किडी ने लिखा है कि है ना, he finds out the insects which are crawling up the ceiling or something, and he is counting them. क्या जरूरत है?
Right.
Yeah, but he is counting them. So that is an automatism.
Okay.
It appears that he is counting them. Then the fist is clenched. Okay, the fist is clenched in this Alzheimer's. Then hypericum. Hypericum में कैसा है? After any injury to the head or the spinal cord, or after fright, bites, shock. Okay, there is spasm after every injury in this hypericum. The convulsions are after any blow to the head or any concussion, convulsions after knocking the body against anything.
Okay.
Okay, मतलब ये after any injury ही ये convulsions नहीं
Injury
है.
or any trauma, yes.
Trauma, yes. अभी इग्निशिया में मैंने जैसे बताया, it is a periodical type of convulsions which is occurring in children. Okay, मतलब at the same hour, 3 बजे तो 3 बजे,
Yes.
4 बजे तो 4 बजे. Okay, the convulsions of children during dentition after punishment. Ignitia को after punishment, after being scolded, after being reprimanded, after being reproached, after any fear, after any fright. Okay, but the convulsions is happening at the same hour of the day. Okay, it returns same hour of the day. Okay, इसमें कैसा है, involuntary laughter भी होगा.
Okay.
Ignitia
Yes.
में there is involuntary
And
laughter
yes.
or involuntary crying with the spasms. Okay, उसमें ना ऑपरेस्ड ब्रीडिंग भी रहेगी. ओके, इग्निशिया में वी सी कि ना उसको ब्रीडिंग का प्रॉब्लम रहता है. ओके, देयर इज एन ऑपरेस्ड ब्रीडिंग, वो सॉबिंग करते रहते हैं. एंड देयर इज अ ग्लोबस हिस्टेरिकस, ऐसा अड़का हुआ है ना, ऐसा लगता है उनको, वो इतना रोते हैं. ओके, देन एलिमेंट्स फ्रॉम इसमें ना बहुत सारे एलिमेंट्स फ्रॉम ही है इग्निशिया में. Okay, so it may be a constitutional remedy also of the.
Yes.
There is catalepsy with opisthotonus. Catalepsy मतलब क्या, कोई भी है ना convulsions जिसमें there is a loss of consciousness and the patient will fall down. Okay, that is catalepsy with opisthotonus. Now ऐसा लिखा है कि है ना natramure should follow in chronic conditions.
Natramure should
follow in the chronic conditions. In chronic epilepsy, the natramure का हम सोच सकते हैं. Okay, ailments from both सारे हैं इसमें. After disappointment in love, jealousy, even spinal
after
injuries are here.
misdeeds of others.
Yes, rudeness of others. Then calibrome. Okay, calibrome में कैसा है, the hands and fingers are in a constant motion, as I told, trembling. Okay, tremors. There is twitching of the fingers, jerking of the muscles, trembling of the hands during voluntary motion. There will be unsteady gait also. Okay, the gait will also be not that steady, and the patient will not be able to stand in a straight position. Okay, the legs are also weak. अभी क्यों? Now अभी ailments from इसमें बहुत सारा दिया है, इसमें worry भी दिया है, इसमें दिया है लॉस ऑफ बिजनेस, लॉस ऑफ रेपुटेशन. लेकिन ये सब है ना चाइल्ड के इसमें हम नहीं सोच सकते. ओके, अभी चाइल्ड के इसमें व्हाट वी विल थिंक ऑफ इज दैट इलनेस और डेथ ऑफ अ नियर फ्रेंड. ओके, illness or death of a near friend at that time, and after that the epilepsy episode has been started, then we can think of this calibrome remedy in children. And even during the time of puberty, calibrome can be taught during the time of puberty and during dentition also. Okay, in males and in females जरा epilepsy देख लेते हैं इसका. In males it is associated with sexual excess or sexual abuse. Okay, even if the child has been sexually abused and उसके बाद है ना उसका epilepsy शुरू हुआ है, so we have to think of calibrome. Okay, in females the fits occur during menses, at the time of puberty, during menses, and usually during the new moon के टाइम पे भी है ना उनको epilepsy होता है. And this epilepsy is followed by headache. ओके,
Okay.
नाउ एज वी कैन सी ये सेक्सुअल स्फीयर से ही रिलेटेड है, उसको है ना हेडेक हो रहा है बाद में, हाँ, इट इज लाइक बुफो,
Buco. Right.
बुफो और कालीब्रोम, ओके, लेकिन कालीब्रोम में थोड़े सीरियस टाइप ऑफ एलिमेंट्स फ्रॉम दिख रहे हैं, ओके, अब्यूज हो रहा है या कोई फ्रेंड हैज डाइड, नियर फ्रेंड हैज डाइड,
Yeah.
और देयर इज वरी, कॉन्स्टेंटली वरी है, ओके। एक रेमेडी हमने देखी थी लाइसिनम, ओके, लाइसिनम वाज समवेयर, इट वाज आई थिंक कोई तो रुब्रिक में था,
Approach of strangers.
ओके,
Child.
अप्रोच ऑफ स्ट्रेंजर्स, यस,
Yeah.
लाइसिनम। नाउ अप्रोच ऑफ स्ट्रेंजर्स तो है, उसके और भी कॉजेस है, convulsions or spasm is brought on by dazzling light or after the sight of a running water, okay, now what is this dazzling light, जब पानी के ऊपर है ना लाइट का फोकस आता है और जो वो चमक दिखती है, that is a dazzling light, okay, so there is trembling or queering sensation throughout the whole body, ये है लाइसिनम का, इसमें ना एलिमेंट्स फ्रॉम ही ज्यादा इंपॉर्टेंट है, ओके। मग सॉल में कैसे है, देर विल बी सप्रेस्ड फुट स्वेट,
Okay.
suppressed foot sweat, and there will be convulsions, cataleptic rigidity of the body, and मक्सॉल हमने देखा था epileptic form,
Epileptic
seizures,
form.
seizures,
Yes.
yes, cold heels will also be there, the heels will be cold, okay। अभी एक ट्रायो याद रखते हैं, एक ट्रायो, ओके, ailments from after head injury, ओके, आफ्टर हेड इंजुरी अगर है ना कन्वर्जन हो रहे हैं तो उसमें है नेट्रम सेल्फ, ओके, हाइपरिकम एंड सिक्यूटा, नेट्रम सेल्फ, हाइपरिकम एंड सिक्यूटा। अभी एक अलग ट्रायो देता हूं मैं, ओके, एलिमेंट्स फ्रॉम आफ्टर ब्रेन ट्यूमर और फ्रॉम अ स्पेस ऑक्युपाइंग लीजन,
Okay.
ओके, उसमें आएगा कोनाएम, प्लम्बम मेट एंड सिक्यूटा,
Lumbar mat and again Secuta.
सिक्यूटा, यस, अगेन सिक्यूटा, ओके। निकोलम मेट का हमने देखा था, ये
When you try to hold them.
यस, व्हेन यू ट्राई टू होल्ड देम, एक कुछ तो है ना पूछा गया है, सॉरी टू इंटरफियर, हैव वी डिस्कस्ड अबाउट फिब्राइल कन्वर्जन्स विद सीजर्स, यस वी हैव डिस्कस्ड ऑन दैट, उसका डिस्कशन हो गया था, फिब्राइल कन्वर्जन्स विद सीजर्स, ओके। उसमें बेलाडोना है, उसमें नक्स वोमिका है, अगर हाँ नक्स वोमिका आई थिंक रह गया था, सो नक्स वोमिका के भी बता देता हूँ, देयर इज spasmic, there is tonic spasms, okay, tonic spasms with consciousness, okay, tonic spasms with consciousness, amelioration by but amelioration by grasping tightly, here we can see there is amelioration by grasping tightly, थोड़ा सा टच करेंगे नक्स वोमिका को वो स्पैजम में चला जाएगा, लेकिन ग्रास्प टाइटली करेंगे ना उसका स्पैजम है ना एमुलरेट हो जाएगा, कम हो जाएगा,
Okay.
रुके जाएगा,
Okay.
okay, then even there is epilepsy during stool is in nux vomica, epilepsy during stool, there is epileptic fits during fever, so febrile convulsions के लिए, now why is this nux vomica having convulsions is because of anger and because of some alcoholic drinks, okay, and alcoholic drinks अभी चिल्ड्रन के बारे में हम सोच हैं, नहीं सोच सकते हमें. We have to see.
In terms of child abuse, yes.
Yes. Then नक्स मोशेटा भी देख लिया था. नक्स मोशेटा. Yes.
That's
Fainting fits
most
रहता है.
yes.
Yeah. Spasm of children with diarrhea.
Yes. Indirect.
With diarrhea. Okay. उसमें fainting fits रहता है. Now it is like fainting fits with heart failure. Okay. Fainting fits with heart failure. Heart failure की तरफ भी हो जाता है. And there is aggravation at stool, at menses, with slight pain from even the sight of blood. He can get into convulsions. Blood देख लिया convulsion में.
Mm-hmm.
And while standing also, when the child is getting dressed, okay, when the child is getting dressed, he gets a fainting fit, okay, and epilepsy. So that is also nux moschata. Then opium भी देख लिया था. Opium भी देख लिया था. I think opium is epilepsy from a fright. When the child
Approach of
is
strangers again.
yes, approach of strangers, and even when the mother is nursing the child and mother had anger or fright, and here mostly the fright is
Mostly
important.
fright.
Yes. And even in opium में कैसा रहता है कि ना heated room रहे, या अगर वो बाथ को गया, okay, and वो रूम गर्म हो गई, बाथरूम गर्म हो गई, and he gets into convulsions, okay, that heated room or bath, after bath the patient gets into convulsion. Even the child, even ऐसा भी लिखा है कि है ना, even the child is उसको है ना गर्म पानी से है ना नहलाए तो वो convulsion में चला जाता है. Okay, so that is in opium. Then प्लम्बामेट का कैसा है, एक कॉज देखा था हिमरेजिक, या जिसमें ब्लीडिंग होते, ब्लीडिंग टेंडेंसीज. ये ब्लीडिंग टेंडेंसीज के टाइम पे ना वी कैन थिंक ऑफ प्लम्बामेट. Okay, because there is convulsions with hemorrhage in plumbermet, and there is a chronic type of epilepsy with marked aura. Okay, the child can tell that from where the aura gets started. Okay, and there is epilepsy. Okay, there is a chronic epilepsy, and उसके साथ है ना hemorrhages होते हैं. And in pulsatilla ka it is related to the menses. Epilepsy with absent or irregular menses. Okay. Silicea का कैसा है? Silicea solar plexus. Solar plexus I told you where the solar plexus is. Okay. So the convulsions is beginning with from the solar plexus. और है ना सिलिशिया में कॉज क्या होगा, चाइल्ड में पहले convulsions नहीं आते थे, but after vaccination he may experience convulsions.
Convergence.
That is silicea. उसको solar plexus से there is creeping to the chest and to the stomach, the epilepsy.
Stomach and the arms also.
Yeah, and the arms also. Stramonium में कैसा रहेगा? There will be fear, fright, and the convulsions is triggered by bright light. Fear, fright, convulsion is triggered by bright light.
Bright light.
Yes. सल्फर का कैसा है? सल्फर में भी वो माउस लाइक फीलिंग है, epilepsy with a feeling that the mouse is running up the arm, लेकिन वो है ना बैक तक जाता है. Okay, it is not going in front.
This is epilepsy or the aura?
This is epilepsy with a feeling. So it is an aura. Epilepsy with a feeling that the mouse is running up arms to the back before the feet. Okay, it is before the feet. Tarantula का मैंने बताया, when any stranger is approaching, that child is going into convulsion.
Yes.
Okay, उसमें उसको punishment मिलेगा, ill effects after punishment, scolding, bad news, unrequited love, sepsis. Okay, In septic type of fevers, if we are getting these convulsions, okay. टॉक्सिकोप्लाज्मा गोंडाई का मैंने बोला कि है ना, मुझे कुछ मैटर नहीं मिला, कुछ मटेरियल मिला नहीं. Okay. In veratrum album, it is like the child is going into convulsions, which is caused by religious excitement. Okay, the cause is a religious excitement. And in zincum met, the convulsion is due to suppressed eruptions. Okay. बस I think खत्म हो गया.
Yeah.
बहुत सारे हो गए.
Yeah. There are a lot of remedies actually which may help us in emergencies like epilepsy.
Yeah, I told 90 something.
96.
96
Yes.
medicines. So उसमें से भी है ना बहुत सारे कवर किए. We had covered 36 remedies. Right.
Wow.
Okay. 36 remedies और उसके indications जो भी characteristic है वो देखें.
Yes. And epilepsy itself is a very big topic.
Very
Actually.
big topic. Yes.
Yes.
थोड़ा मुझे बताना है ये ग्रैंड मैल एपिलेप्सी के बारे में थोड़ा बता देते हैं.
Yes, please.
ओके. पेटिट तो हो गया था, ग्रैंड मैल रह गया था. ओके. देयर इज ऑलवेज अ ऑरा दैट प्रीसीड्स द अटैक. ओके. देयर इज अ लॉस ऑफ कॉन्शियसनेस इन ग्रैंड मैल एपिलेप्सी. ग्रैंड मैल एपिलेप्सी मतलब टिपिकल टाइप ऑफ एपिलेप्सी जो है ना, हम लोग सोचते हैं, हम लोग ये ना एक ऑरा आता है, आदमी गिर जाएगा, उसका कॉन्शियसनेस चला जाएगा. ओके. देयर इज स्टिफनेस और रिजिडिटी ऑफ द बॉडी विथ फॉलिंग डाउन. ओके. बॉडी एकदम स्टिफ हो जाती है, रिजिड हो जाती है, एंड द patient will fall down. Okay. The respiration will get arrested, and there will be the blueness of the body. Okay. Respiration is getting arrested, so there is hypoxia and there is a blueness of the body is occurring. And now after this stiffness, there is relaxation of the body. Okay. After this stiffness, there will be relaxation of the body, and this relaxation will result into jerking of the body. Okay. The body was stiff, now it suddenly got relaxed, and now it's jerking. Okay. And after this jerking gets stopped, there will be regaining of the consciousness. Okay. The consciousness gets regained, and after regaining of the consciousness, the patient may feel confusion, impaired memory, headache and sleepiness.
Yes.
ओके. और इसके लिए हमने अलग अलग रेमेडीज भी देखे. हेडेक अगर है ना, वो आफ्टर अटैक उसको हेडेक हो रहा है, स्लीपीनेस हो रहा है, या अगर कंफ्यूजन भी हो रहा है, उसके लिए भी रेमेडीज मिल जाएंगे.
That was Buforana and
Buforana and Calibrom. Yes. Yeah. So and even the loss of bladder control and tongue bite are common in this grand mal type of seizures. Okay. And this grand mal type of seizure is coming into, as you correctly told, in the general seizures, generalized seizures.
Yes.
Okay. And even the petit mal is in generalized seizures.
Yeah.
Okay. The whole body is getting involved, even the whole brain is getting involved. So that is general seizure. Or focal seizure, so you told. फोकल सीजर फोकस से ही पता चल जाता है कि है ना, फोकस, देयर इज अ फोकस इन द ब्रेन. ओके. देयर इज इन्वॉल्वमेंट ऑफ वन एरिया ऑफ द ब्रेन. ओके. आई थिंक डेविडसन में भी ऐसा दिया है कि है ना, वो कहाँ पे फोकस है उससे रिलेटेड है ना एपिलेप्सी भी होता है.
एपिलेप्सी होगा. यस.
ओके. मतलब ऑसिपिट के इधर फोकस है at the occipital region, so the visual disturbances will be there. Okay. And even the trigger will be visual. थोड़ा डिले हुआ था इसलिए. Even the trigger will be visual. Okay. Auditory area में even the trigger will be auditory, noise will be there. ऐसा भी है. So I think let's stop it.
Yeah. So it
Next
was
topic
quite a big discussion,
session.
although the
Yes.
topic itself was very broad and very
और बहुत
uh,
लोग लाइव छोड़ के चले गए क्योंकि बोर हो गए होंगे शायद.
probably, but it did benefit a few, I believe.
अरे इट विल बेनिफिट क्योंकि है ना वो इसके बाद वीडियो भी देखेंगे.
Yes. Sure.
Yes. And let's think of another topic for the next
Yes,
HomPed
and
session.
the suggestions are very much welcomed.
Yes.
Yeah,
Suggestions
any
are
kind
very
of
much welcome.
improvement that we need to do in the sessions, any kind of changes that we need to do in the sessions, such suggestions are
Yes.
also welcomed.
Yes. All the suggestions you can give in the comment box. We are going
Yes.
to post this video. So and even the questions which maybe remained unanswered can be asked on the comment box.
I have a question here by Jayesh. Can lack of oxygen during birth affect a newborn with epilepsy? Yes, definitely.
Yes,
Hypoxia, as
definitely.
we discussed, hypoxia is a deficiency or the oxygen levels in the blood get decreased, and it definitely can cause epilepsy.
Yes. I think
All right.
no
So
other
I
questions
believe we
are there.
should, yeah, we should wind up the session now.
Yeah.
Okay.
Yes.
Yeah, so probably next Saturday, we will be again coming up with a new topic to discuss and to see how homeopathy benefits in
Yes.
pediatrics.
In pediatrics. Yes.
Yeah. All right. Thank you
Okay.
so much. Thank you all the viewers to
Thank you
staying
all the viewers
glued with
for
us.
this long session.
All right.
Long and detailed session
Goodbye.
actually.
Yeah.
Goodbye. Bye.